lumbar spine rotation mobilizations. Two different positions. First position, supine. This is perhaps the gentler of the two techniques. Very nice technique and very good for your patient to be able to do these as active mobilizations at home as well, as opposed to seated, which it's not really as good to do as a self-mobilization. But patients love these in supine. So again, we're going to be nice and careful, just raising the legs up, okay, against the body, raising this leg up and together. Now the amount of flexion that we add to the femur and obviously into the hip will affect, to a degree, where the rotation is happening within the lumbar spine. The more flexed we are, the lower in the lumbar spine the rotation is occurring. This position here is probably around about L3, L4. For absolutes going into L5 and maybe into L5S1, we'd want the legs up at around 90 degrees. I'll show you that one in a sec. But here is around L3, L4, and if we want to come slightly higher up the spine, then come down to around a 45-degree angle, which would then be around L1, L2. It's a rough guide, okay, so don't see that as, you know, this is exactly precise and what it will always be. It just gives you an idea that down, you know, the further away you go, the further away you're working on the lumbar spine, and the more the leg comes up, the lower down the lumbar spine, so it all comes together. So I'm going to do it in a slightly more flexed position, just in here. Okay, now what we're going to do is when we're taking the legs towards us, because we want to be able to essentially feel like we can catch them. Arms are in this position here, just nice and relaxed generally. This arm is across the body so it doesn't get in the way of the pelvis. As they come over, that's when we start to really get more towards into our resistance, so our grade 3s and 4s. We can see how we might be able to adjust the upper body as well to help that. So we come across. Really, really important you're stabilising and supporting. You saw there a tiny bit of movement just from the foot. That's because the legs are trying to track themselves down there. So really stabilise and support. They can come over, and obviously we can do this as part of our assessment, seeing if there's any pain at all. Okay, if we were looking at, say, an early into range grade 1, we might just be here. This might be all we need to do. Grade 2, we might be out here. Again, we're out of resistance. Grade 3, come over. Should need to apply a bit more force now on top. So I'm lifting, pressing, lifting, pressing. Now grade 4, more towards the end of range, just in here. But notice how fluid the movements are. No jerking at all. Never ever jerk a motion for the spine. Patient spasm up straight away. If I was going for L5, S1 type region, a little bit harder to perform, because what you want to do is you want them to be relaxed, but at the same time you've got to raise their feet off the bed. Now an option would be to put something on the bed to try and raise their feet up if you've got any blocks or foam or anything like that. But if not, you're going to need to take control of it. Okay, so what we can do is we can raise up into flexion here, and now they need to roll over and towards me. So I'm using my knees coming over and down. Quite a difficult technique to do, especially if you set yourself a high target in terms of reps, so don't do that. Back up. Okay, another way of doing lumbar spine mobilisation for rotation is to have them seated. So if you'd like to sit up for me and face towards the main wall here. Okay. Push back to the back of your knees into the back of the bed. As with the side flexion or anything where they're really seated, ideally, so it's always possible, ideally, pop something underneath the feet raise this bed slightly. Okay, and then our motion is again going to have to come from the rib cage, so we're mobilising from the top down. So holding onto the rib, twisting essentially from here, from the lower thoracic region, and as that twists round, hopefully the pelvis stays still, so we counter-rotate across the lumbar spine. So this arm's going to come across, again, consent, etc. is very, very important. Round into here, this is quite a reach to get this one right the way round, which is a good thing, because as you apply that tension, it naturally then tries to rotate you so they come towards you. This hand's then going to come onto here, onto the closer side, and obviously I'm going to push that round in that direction. So from there, we can then twist. Now I know what you're thinking, wow, that doesn't move very far. Of course it doesn't. Lumbar spine, and he moves around 1 degree per level, 5 levels, so it's around 5 degrees of rotation. Okay, so if we were towards the end of range, just in here, then that would be grade 4. So this is a passive physiological rotation. Don't confuse it with the passive accessory rotation, which you can see in another video.